Assalamu alaikum students. Our today's topic is gross anatomy of fascias of neck, hyoid bone, suprahyoid and infrahyoid muscles. So let's start with the topic. Today we are going to start with neck region. So for the purpose to understand and simplify the anatomy of the neck, we will divide the neck into two halves or two sides because same structures are present bilaterally. So first we will define the boundaries of the side of the neck. Side of the neck is quadrilateral in shape and it is bounded anteriorly by the anterior median line, which is an imaginary line, posteriorly by the anterior border of trapezius muscle, superiorly by the base of the mandible, a line joining the angle of the mandible to the mastoid process, and superior knuckle line, inferiorly by the clavicle. Now have a look on the diagram. You can see the anterior median line, which is an imaginary line, and posteriorly it is bounded by the anterior border of trapezius. Superiorly it is bounded by the base of the mandible and a line joining the angle of the mandible to the mastoid process along with सुपीरियर नक्कल लाइन. ठीक है, ये एक कॉन्टीन्यूटी में सारी इसकी सुपीरियर बाउंड्री बन रही है एंड इन्फीरियरली इट इज़ बाउंडेड बाय द क्लेविकल. अब इसके दरमियान में आपको जो मसल नज़र आ रहा है ओब्लिकली प्लेस्ड, जो कि स्टर्नोक्लीडोमास्टोइड मसल है, ये डिवाइड करता है साइड ऑफ द नेक को एंटीरियर और पोस्टीरियर ट्राइंगल्स में. इन ट्राइंगल्स की डिटेल्स जो है वो आप अपने नेक्स्ट लेक्चर में कवर करेंगे. Cutaneous nerve supply of the neck. The anterolateral part of the neck is supplied by anterior primary rami through anterior cutaneous nerve, great auricular nerve, lesser occipital and supraclavicular nerves. Posterior part is supplied by dorsal or posterior primary rami of cervical plexus, as you can see in the diagram. Now the fascia of the neck. Like other regions in the body, structures in the neck are also surrounded by a layer of subcutaneous tissue, which is superficial fascia, and by the layers of deep cervical fascia. So let's first talk about superficial fascia. It is a thin layer of fatty connective tissue that lies between the dermis of the skin and the investing layer of deep cervical fascia. Now, what is investing layer of deep cervical fascia? It is the outer superficial layer of deep cervical fascia, which we will discuss in detail later on in this lecture. And this superficial fascia contains cutaneous nerves, blood and lymphatic vessels, and variable amount of fat. It is relatively thin when compared with the superficial fascia in other regions of the body. Anterolaterally, it contains the platysma, which is a broad, thin sheet of muscle in the subcutaneous tissue of the neck, and it is supplied by the cervical branch of facial nerve. You can see platysma in this diagram, and as a muscle of facial expression, it serves to convey tension or stress. Now come to the deep cervical fascia of the neck. Deep cervical fascia is multi-layered fascia which is condensed to form the following layers. First one is the investing layer, then pre-tracheal layer, pre-vertebral layer, and last one is the carotid sheath. In this diagram, you can see these layers of deep cervical fascia. The function of the deep cervical fascia is to support the structures present in the neck, including viscera, muscles, vessels, and deep lymph nodes, and it allows structures in the neck to move and pass over one another during swallowing and turning the head and neck. They form compartments for the structures in the neck In this way, they form natural cleavage plane and limit the spread of abscess. Investing layer of deep cervical fascia. It lies deep to the skin and subcutaneous tissue and surrounds the neck like a collar. It is the outermost layer of the deep cervical fascia and is attached superiorly with the external occipital protuberance and superior knuckle lines, mastoid process, external acoustic meatus, base of mandible, and spinous processes of cervical vertebrae. Now let's have a look at the diagram. In the above diagram, you can see the line of attachment. Here the investing layer is attached in continuity from before backwards, where you can see the superior attachment at the base of the mandible, then the external acoustic meatus and mastoid process, then superior knuckle lines and external occipital protuberance, and then it is attached to the spinous processes of the cervical vertebrae. Between the angle of the mandible and mastoid process, the fascia splits into superficial and deep lamina to enclose the parotid gland and forms its capsule. Another modification is the stylomandibular ligament. At the base of the mandible, it splits to enclose submandibular gland. Inferiorly, the investing layer is attached with the spine of scapula, acromion process, clavicle, and manubrium. In the above diagram, you can also see these attachments, and in the lower diagram, ठीक है, नीचे वाली डायग्राम्स में आप देख रहे हैं कि ये इन्वेस्टिंग लेयर ने ऑल अराउंड द नेक जो है इसको कवर किया हुआ है लाइक अ कॉलर. Anteriorly, the investing layer of deep cervical fascia is attached to the symphysis mentae and hyoid bone, and posteriorly it is attached to the ligamentum nuchae and spine of seventh cervical vertebra. Ligamentum nuchae is a triangular membrane that forms a median fibrous septum between the muscles of the two sides of the neck. Now, here are some important features related to the investing layer. The fascia splits to enclose two muscles which are sternocleidomastoid and trapezius. In the first one diagram, you can see a horizontal section in which a green outline shows the investing layer of deep cervical fascia which splits to enclose the trapezius and sternocleidomastoid muscles. The fascia also splits to enclose two salivary glands which are parotid and submandibular glands. We already discussed in the previous slide, and two spaces which are suprasternal space and supraclavicular space. Suprasternal space or space of Burns is situated just superior to the manubrium, and it contains the sternal heads of right and left sternocleidomastoid muscle, the jugular venous arch, and a few deep lymph nodes. While the supraclavicular space is situated above the clavicle between sternocleidomastoid and trapezius. In the lower one diagram, in the third diagram, you can see the supraclavicular space, and this space is traversed by external jugular vein, the supraclavicular nerves, and cutaneous vessels. Now the pre-tracheal fascia. The thin pre-tracheal layer of deep cervical fascia is limited to the anterior part of the neck. It includes a thin muscular part which encloses infrahyoid muscles and a visceral part which encloses the thyroid gland, trachea, and esophagus. It extends from hyoid bone to the thorax. Its attachments are: superiorly, it is attached to the hyoid bone, oblique line on the thyroid cartilage, and cricoid cartilage. Inferiorly, it extends into the thorax, where it blends with fibrous pericardium covering the heart, and on either side it blends with the carotid sheath. अब इस डायग्राम में आपको जो रेड आउटलाइन है वो नज़र आ रही है, वो प्री-ट्रेकियल फेशिया है, ठीक है, विच इनक्लोजेस द इंफ्राहायोइड मसल्स एज यू कैन सी एंड the viscera which are trachea, esophagus and thyroid, and posteriorly or on either side it blends with the carotid sheath. A very important feature of pre-tracheal fascia is that it encloses and suspends the thyroid gland and forms its false capsule. On either side, it forms a suspensory ligament for thyroid gland known as ligament of Berry. The ligaments are chiefly attached to the cricoid cartilage. They support thyroid gland and do not let it sink into the mediastinum. The thyroid gland and all thyroid swellings move with deglutition because thyroid is attached to cartilages of larynx by the suspensory ligaments of Berry. Another important clinical correlate, the neck infections in front of pretracheal fascia may bulge into the suprasternal area or extends down into the anterior mediastinum because inferiorly it extends into the anterior mediastinum. Pre-vertebral layer of deep cervical fascia forms a tubular sheath for vertebral column and muscles associated with it, which are longus capitis and longus coeli anteriorly, scalenes laterally, and deep cervical muscles posteriorly. It is attached superiorly to the base of skull. Inferiorly, it blends with the endothoracic fascia peripherally and fuses with the anterior longitudinal ligament centrally at approximately T3 vertebra. Laterally, it extends as axillary sheath which surrounds axillary vessels and brachial plexus. In the diagram, you can see the purple colored outline shows the pre-vertebral fascia covering the pre-vertebral muscles, and anteriorly it blends with the carotid sheath. Now the retropharyngeal space. It is a potential space between the visceral part of the pre-vertebral layer and the buccopharyngeal fascia surrounding pharynx superficially. Buccopharyngeal fascia डिटेल में आप pharynx के साथ पढ़ेंगे. The retropharyngeal space consists of loose connective tissue and permits movements of the pharynx, esophagus, larynx, and trachea relative to the vertebral column during swallowing. The alar fascia forms a further subdivision of retropharyngeal space. This thin layer is attached along midline of buccopharyngeal fascia from the cranium to the level of C7 vertebra. इस डायग्राम में आप रिट्रोफेंजियल स्पेस देख सकते हैं और इसके साथ एलर फेशिया भी आपको नज़र आ रहा है, ठीक है. ऊपर आपको जो डायग्राम नज़र आ रही है वो सैजिटल सेक्शन आपको शो किया गया है और नीचे जो है वो हॉरिजॉन्टल सेक्शन में आपको रिट्रोफेंजियल स्पेस जो है वो शो की गई है. अब इसकी कम्युनिकेशंस जो हैं वो बहुत ज़्यादा इंपॉर्टेंट हैं. द रिट्रोफेरेंजियल स्पेस इज़ क्लोज्ड सुपीरियरली बाय द क्रेनियल बेस एंड ऑन ईच साइड बाय द कैरोटिड शीथ. इट ओपन्स inferiorly into the superior mediastinum. Carotid sheath is a tubular facial condensation that extends from the cranial base to the root of the neck. This sheath blends anteriorly with the investing and pre-tracheal layers of deep cervical fascia and posteriorly with the pre-vertebral fascia. In the above diagram, you can see that carotid sheath is superiorly attached to the base of the skull at the carotid canal, around the carotid canal, and inferiorly it is attached to the arch of the aorta and in this way the carotid sheath communicate freely with the cranial cavity superiorly and the mediastinum of the thorax inferiorly. Its contents are common and internal carotid arteries, internal jugular veins, vagus nerve, and some important relations are that the ansa cervicalis lies embedded in the anterior wall of the carotid sheath and the cervical sympathetic chain lies behind the sheath. Now the most important clinical correlate is spread of infection. ठीक है, ये आपसे वाइवा में भी पूछा जा सकता है और रिटन में भी. The investing layer of deep cervical fascia helps prevent the spread of abscess caused by tissue destruction. If an infection occurs between the investing layer of deep cervical fascia and the muscular part of the pre-tracheal fascia surrounding the infrahyoid muscles, the infection will usually not spread beyond the superior edge of the manubrium of the sternum. And if the infection occurs between the investing fascia and the visceral part of the pre-tracheal fascia, which surrounds the viscera like trachea, esophagus, and thyroid, then it can spread into the thoracic cavity anterior to the pericardium. Now, the pus from an abscess posterior to the pre-vertebral layer of deep cervical fascia may extend laterally in the neck and form a swelling posterior to the sternocleidomastoid muscle. प्री-वर्टिब्रल लेयर जो है वो एक्सटेंड करती है लेटरली एज एक्सिलरी शीथ. इस वजह से जो है वो लेटरली एक्सिला में भी जो है वो पस स्प्रेड हो सकती है, इन्फेक्शन स्प्रेड हो सकता है. द पस में परफोरेट द pre-vertebral layer of deep cervical fascia and enter the retropharyngeal space. ठीक है, retropharyngeal space अभी हमने पीछे डिस्कस किया है कि ये एक पोटेंशियल स्पेस है बिटवीन दी बकोफेरेंजियल फेशिया एंड दी प्री-वर्टिब्रल फेशिया. ठीक है, इसलिए जो पस है वो जब प्री-वर्टिब्रल लेयर है उसको परफोरेट करती है तो रिट्रोफेरेंजियल स्पेस में ये पस आ जाती है, तो इस इन्फेक्शन को रिट्रोफेरेंजियल एब्सेस कहते हैं. दिस एब्सेस मे काज डिफिकल्टी इन swallowing एंड स्पीकिंग. ठीक है, आपको जो डायग्राम है नीचे उसके अंदर रिट्रोफेरेंजियल एब्सेस जो है वो दिखाई गई है. Now the infections in the head may also spread inferiorly, posterior to the esophagus and enter the posterior mediastinum, or it may spread anterior to the trachea and enter the anterior mediastinum. Infections in the retropharyngeal space may also extend inferiorly into the superior mediastinum. Similarly, air from a ruptured trachea, bronchus, or esophagus can pass superiorly in the neck. ठीक है, अगर आपको इस फेशिया की कम्युनिकेशंस आपको इसकी लिमिट्स ये सारी चीज़ें याद होंगी तो आप इसके स्प्रेड को इजीली अंडरस्टैंड कर सकते हैं. And it is very important. Hyoid bone. It is a small bone and lies in the anterior part of the neck at the level of C3 vertebra in the angle between the mandible and the thyroid cartilage. The hyoid is unique among bones for its isolation from the remainder of the skeleton. It is suspended by the muscles and does not articulate any other bone. It is a U-shaped bone and consists of a body and greater and lesser horns or cornu. The body of the hyoid, which is its middle part, faces anteriorly. You can see the middle part of the hyoid bone in the diagram, which is the body of the hyoid bone. Its anterior convex surface projects anterosuperiorly and its posterior concave surface projects postero-inferiorly. Each end of its body is united to a greater horn that projects postero-superiorly and laterally from the body. A small bony projection, which is the lesser cornu or lesser horn, is present at the junction of the body and greater cornu. Functionally, the hyoid bone serves as an attachment for anterior neck muscles and a prop to keep the airway open. It maintains the patency of the pharynx and helps in the swallowing. In the next diagram, you can see the muscle attachment on the hyoid bone, and now the fracture of the hyoid bone. It occurs in people who are manually strangled by compression of throat. This results in depression of body of hyoid bone onto the thyroid cartilage, which results in inability to elevate the hyoid and move it anteriorly beneath the tongue, makes swallowing and maintenance of separation of alimentary and respiratory tracts difficult and may result in aspiration pneumonia. In this diagram, you can see the inward compression in case of throttling and outward compression in case of hanging. It shows the fracture of hyoid bone. Now here are suprahyoid and infrahyoid muscles are in tabulated form. The suprahyoid muscles are digastric, which arises from base of cranium, stylohyoid from styloid process, mylohyoid from medial body of mandible, and geniohyoid from anterior body of mandible. And these all suprahyoid muscles inserts on the hyoid bone, and their action is to depresses the mandible against resistance. And infrahyoid muscles are omohyoid, which arises from scapula and inserts on hyoid bone, sternohyoid, which arises from manubrium of sternum and inserts on hyoid bone, sternothyroid, which arises from manubrium of sternum and inserts on thyroid cartilage, and last one is the thyrohyoid, which arises from thyroid cartilage and inserts on the hyoid bone. And the action of these infrahyoid muscles is to depresses or fixes the hyoid bone. In the diagram, you can see all these suprahyoid and infrahyoid muscles. Now here are suprahyoid and infrahyoid muscles are in tabulated form. The suprahyoid muscles are digastric, which arises from base of cranium, stylohyoid from styloid process, mylohyoid from medial body of mandible, and geniohyoid from anterior body of mandible. And these all suprahyoid muscles inserts on the hyoid bone, and their action is to depresses the mandible against resistance. And infrahyoid muscles are omohyoid, which arises from scapula and inserts on hyoid bone, sternohyoid, which arises from manubrium of sternum and inserts on hyoid bone, sternothyroid, which arises from manubrium of sternum and inserts on thyroid cartilage, and last one is the thyrohyoid, which arises from thyroid cartilage and inserts on the hyoid bone. And the action of these infrahyoid muscles is to depresses or fixes the hyoid bone. In the diagram, you can see all these suprahyoid and infrahyoid muscles.